Good evening and happy 2022. Happy New Year. Happy January 6th. It's a tricky day in our country. So if you're happy about January 6th, congratulations. If you're disturbed about January 26th, I feel you. And this is Dr. Maria Sophocles. We're live tonight doing an episode of Gynecology on the HPV vaccine, myths about the vaccine, and just overall some education about HPV. HPV is a virus. I think it's pretty commonly known at this point. It was really not discovered until the 1980s. So it's in general a very new and recent discovery. It was discovered in Baltimore at Johns Hopkins. And for anyone who wants an interesting read or an interesting book about HPV and how we came to learn about the virus and what it does, and the rather sad story about the woman in whom it was diagnosed. There's a book called The Immortal Life of Henrietta Lacks, Lacks. And it's just an amazing book, an amazing story. Anyway, off topic a little bit. Tonight, we're going to talk about HPV in the context of the HPV vaccination. For the past year or more, vaccination and the concept of vaccination has been on the tip of everyone's tongues with respect to COVID. And sadly, since COVID and the COVID pandemic, the rate of HPV vaccination has decreased. We're not sure whether that's because people are just staying home, not going to their doctors. That's probably a big reason, or because people are now just more hesitant or afraid of vaccines. But either way, it's been unfortunate. Only 16% of American teens are vaccinated. 16. That's really lousy. Our goal is 100%. So we're really falling far, far short of the mark. So tonight we're going to talk about that. If you're listening live, please ask a question. This is really much more fun if it's a Q&A than just me monologuing about it. I got a bunch of questions from people, and I thought about over the last 28 years, what are some of the most common questions I've gotten asked about the vaccine? So I wanted to go through some of those questions with you, and hopefully I'll answer some of your questions. And if I don't, please send me your questions, call me or email me. Go on my website, princetongyn.com, and you can find my email, or call in tonight and we'll be able to answer your question. So HPV, human papillomavirus, how common is it? HPV infection is actually the most common STI in the United States. About 80 million Americans are infected currently with HPV. It's omnipresent. So it's not something you're going to likely escape exposure to unless you're either never have sexual or genital contact with anyone, which is pretty unlikely, or you are in a long-term monogamous relationship and that person happens to not have HPV. And the next question I always get is, well, how do I know if my partner, male or female, has HPV? The answer is you do not know. There is no sign on anyone's head. There's no blue spot on their genitals. There's no strange discharge. There's really no symptoms of the strains of HPV that cause abnormal cells to form on the cervix, the throat, the anus, or the vulva or the vagina. So unfortunately, the best thing you can do other than abstinence is to get an HPV vaccine. HPV vaccination is the only vaccine ever developed against cancer. So just the whole concept of a vaccine that can prevent not one, but many types of cancer is staggering, it's dramatic, and it's very important. I read a lot of people's concerns that this vaccine was just something created by pharma companies to make money. that doesn't really make sense, because pharma companies, yep, they are for profit, just like lots of companies, but that doesn't mean that the vaccine doesn't work, and that doesn't mean that it can't help you. And frankly, I don't mind paying for something that'll help reduce my risk of cancer. I don't really feel right to ask somebody to spend millions and millions of dollars developing a vaccine and then not sell it to someone. I expect them to get their money back. So if you're one of the people that's concerned about the fact that a pharma company is making money off of a vaccine, my suggestion is that you ask yourself if you would rather have the cancer but deprive them of their tiny amount of money for that vaccine, or not have the cancer. I can tell you right now, I've seen enough cancer in my 28 years of practice to know I don't want cancer, and I don't mind paying for it. But lucky for you and for me, we don't actually pay directly for the vaccination. Our insurance companies do, for sure, but it is covered 100% as far as I know. I'm sure there are some policies somewhere with some fine print that doesn't cover it, but none that I've ever heard of, and I've never, ever had a patient have to pay for any HPV vaccine. So you can't beat the cost, you can't beat the safety, and you can't beat the protection. So if I sound like I'm a salesperson for it, I am. I don't work for those companies. I don't make a penny off of that, but I truly, truly have seen in people who don't get the vaccine what can happen. So let's go through again some of these questions that you all have sent in to me. So how common is HPV? As we said, very common, the most common sexually transmitted infection. How does it spread? Well, it spreads through contact with infected skin. So you don't have to have penile penetration or anal penetration to get HPV. It can be spread during a spin the bottle game. It can be spread by touching the vulva, or touching the scrotum, or touching the scrotum to the vulva, or anything that's sort of external rubbing. There are some studies which suggest it can be spread through sharing clothing or towels. So it's spread through contact of infected skin. And we know, because we know there are virginal women who have never had any sexual contact, women in convents who have acquired HPV. So it's probably easier to get than we even realize. How about the symptoms? So what symptoms do you have when you do get it? Most people who get HPV infected really don't show any symptoms. As I said, nobody gets a sign across their head saying I have HPV. HPV comes in many, many strains. There are well over 200 strains of HPV. Not all of them cause cancer. Some of them do cause genital warts, and those are the only things that anybody can see. They aren't necessarily the same strains as those that cause cancer. So genital warts are usually soft, moist, pink, or sort of flesh-colored swellings, usually in the genital area. And they are contagious in that if you rub up against someone with genital warts or have sex with them, you can get genital warts or anal warts. How serious is HPV? Well, it depends on the strain that you get exposed to. If you get exposed to the strains that cause warts, you're going to get warts, and the warts themselves are usually benign and can be easily treated. If you're exposed to one of the strains that is what's called a high-risk HPV strain, you have an increased likelihood of that HPV infection setting you up for precancerous changes in the cells or even cancer. Where is the cancer? Well, cervical cancer is the most common HPV-associated cancer. And cervical cancer, for anybody who's not sure where the cervix is at the very back of the vagina. So if you were to put a tampon or a penis or your finger into the vagina, what you would hit at the back is your cervix. It's also the entryway to the womb. So if it sort of looks almost like a little bagel or donut, and it opens up to allow the baby to come out. The the cervical cancers most cervical cancers are caused by two types of HPV, two strains. So I think it's 70% of cervical cancers are caused by HPV strain number 16 and number 18. So 16 and 18 are really the bad guys. In fact, they cause most anal cancer, vulvar cancer, vaginal cancer, and penile cancer. So 16 and 18 are definitely two of the bad players. They are the, Pablo and Gustavo Escobar of HPV strains. Throat cancer is caused by 16. 90% of all oral and throat cancer is caused by HPV 16. Throat cancer we see more in men, and we believe this is due to oral sex due to oral sex. So I think that's really important to understand, that HPV does have some not so big deal complications, but it has some really tragic and preventable complications such as cancer. So the cancer tends to occur when the infection is undiagnosed and persistent. So how do we diagnose it? Well, visual inspection is how we diagnose genital warts. You look, you see them, you go to a doctor, the doctor looks and sees them, and the doctor can usually cut them or freeze them or burn them off. Not a fun thing, but it's better than having warts. Cancer screening of the cervix for women is performed by Pap smears. Everybody's heard of a Pap smear. A Pap smear is just a little plastic or wooden swab that gently swabs against the cervix, gets some cells, and then someone looks under the microscope and decides whether those cells look like they've been infected by HPV or not. There are no HPV tests available at this time for men. This really stinks because men absolutely get HPV, and they are sort of the vectors that can transmit HPV to a woman. So a man can have no HPV, have sex with a woman who has HPV, then have sex with another woman who has never been exposed to HPV, and give that second woman the HPV from the first woman. So if that sounds confusing, understand that that is why men should be vaccinated. I can't tell you how many patients say to me, what a silly thing. Why do men have to be vaccinated? They don't have a cervix. Well, you're not getting vaccinated just because you have a cervix. You're getting vaccinated so that the HPV that you have, A, won't give you cervical cancer, but B, you'll reduce the HPV or prevent yourself from getting HPV from other partners, from your partners, so that you in turn cannot give HPV to someone else. And this is why both men and women absolutely should have the HPV vaccine. The HPV vaccine was first developed and licensed in 2006. So this is not a new vaccine. This was not rushed. This is not, something novel. This has been around for a lot of years. When it was first put out on the market, they said, let's start with young girls before they become sexually active. Let's give, 8, 9-year-old, 10, 11, 12-year-old girls the HPV vaccine. And it was wonderful. And those girls that have been followed have far fewer cancers than the girls who were not vaccinated. Then it was expanded to allow for males to have the vaccine. Now, the third expansion of the group that is able to get this vaccine is up until and through the age of 45. So from the age of 8 to the age of 46, insurance companies will pay for this vaccine. If that doesn't tell you how important this vaccine is, I don't know what does. I don't know any other childhood vaccine that an insurance company who never wants to pay for anything will cover until you're 46. Why? Why would they spend the money? Because they know that even if you're 43 and you're newly sexually active with new partners and you can acquire the HPV virus, you can cost that insurance company more money by getting cancer. They don't want to spend that money on you. They would rather spend the money on the vaccine. So now you can get the vaccine up until you're 46 years old. I think that's critical. One of the other questions I get asked all the time is, Well, I'm not a teen anymore, and I've already had abnormal Pap smears, so I think it's too late for me. I've already been exposed. I've already been told I have HPV. The vaccine can't help me, right? Wrong. Now we know that women who already have HPV associated Pap smear changes, who already have an abnormal Pap smear, even who've already had precancerous changes on the cervix, or even cancer of the cervix or the anus, even those women benefit from the HPV vaccine. Why? Because the HPV vaccine protects against 9 different strains of HPV, and new vaccines are coming out which will protect against even more strains. But those 9 strains, of those 9 strains, if you had an abnormal Pap smear, we can type it now. So we may know that you have type 45, one of the high risk strains. I'm so sorry to tell you that. But you should still get Gardasil 9 because Gardasil targets the most common high risk strains. Yes, including 45, but also strains 6, 11, 16, 18. Remember, I said 16, 18 are the worst, 32, 33, 45, 52, and 58. So if you then go have sex with a new partner and that partner has type 16 and you haven't had Gardasil 9, now you've added another HPV infection and risk for cancer on top of the one you already have. So it is not too late to get Gardasil 9. Honestly, no matter what your age, but over 46, it's harder to get it paid for. So that is, if you remember nothing else tonight, if you're interested in the Gardasil vaccine, please ask your healthcare provider. I know at our practice, we always ask women, especially those women who've had abnormal PAPs or precancerous changes on their cervix, we offer them the vaccine. It's weird to feel like you're getting a childhood vaccine as an adult, but man, again, it's so much better than cancer. So let's see. Oh, I know a good question I always get asked. Can genital HPV infection be cured? Can you just cure this? Well, sadly, no. There's no cure for HPV. It's a virus, it's in your body forever. But your body is constantly trying to clear the virus. So that's why you can get a Pap smear one day and it can say no HPV, normal cells. And you can come back the next year and they can say the cells look like they've been exposed to HPV. You have HPV infection. And then the next year, no HPV again. This confuses patients and it confuses a lot of non-gynecologists too. They don't know what to tell patients. Do you have HPV? Do you not have HPV? Well, the answer is you do have HPV. And once you have it, you always have it. The good news is that most people do nothing with that HPV exposure. They never have any negative sequelae. They never get cancer. They never even get precancer. For most healthy people, they can have an HPV viral infection and it doesn't do anything. Okay, that's great news. Unfortunately, none of us know who's going to roll the dice and actually have an HPV infection or a personal predisposition to turn that infection into cancer. So that's why the vaccine sort of makes sense for everybody. So, most women who have HPV infection will become HPV negative, and they may even stay HPV negative. But again, not a reason not to have a vaccine, in my opinion, anyway. How is the vaccine given, by the way? It's given as an injection in the deltoid, this muscle in your arm, or mine's pretty small, but the deltoid. And for men and women under the age of 15, you give 2 shots about 6 to 12 months apart. That's Ruby, my cat. If you get the vaccine over the age of 15, you're gonna have 3 shots. Okay, those 3 shots are given as follows. Pretend today is the first day of your first HPV vaccine. I'm going to ask you to come back to my office in 2 months to get the second vaccine. And I'm going to ask you to come back in 6 months to get the third shot. So 3 shots in 6 months. Everyone asks me this, do the shots hurt? Well, I don't know any doctor that's going to go, yeah, they really hurt, because you'll instantly be the least popular doctor on the planet. But I also will not lie. They don't feel great. You can get soreness at the site. That is the number one most common side effect. So let's just go ahead and ask that question. What are the side effects? Are they dangerous? Are they life-threatening? Are they minor? The answer is the side effects are minor, almost 100% of the time. If you have any side effects from this shot, it's going to be soreness right where you got it, just like any other shot. The other side effects that get reported, fatigue, malaise, muscle or joint pain. There have been some reports of teenagers fainting from the shot, which sounds like a pretty big deal. But when people investigated those reports, it turned out they were teens who were just really anxious and watched as the shot went in, and they just fainted from the fear and anxiety. So I guess that's going to happen to some people. What about major side effects? Can this make you go blind or be sterile, or you can't have kids, or does it cause other cancers or anything like that? The answer is no, no, and no. We know it can't do anything to your reproductive system because it doesn't have whole cells in it. It doesn't have anything that can go into your cells in the ovaries or the testicles. There's just nothing to get there. So it can't affect you. It can't affect whether you're fertile or infertile. It can't prevent you from getting pregnant. It can't really do anything other than cause a little immune response to make you make antibodies to this virus, a lot like the COVID vaccine. It just can't cause sterility or anything bad like that. I guess, to me, that's important because with anything in medicine, there's risk and reward. And I've had people say, well, it's just not worth the risk. And I get that. I don't want people to take risk that's undue or overbearing. But I guess I would ask yourself, is the risk of having a sore arm worth preventing cancer? I mean, it's kind of that simple. So your question might be, well, what if I'm like the first one to just get some weird thing? I mean, that's absolutely possible. But remember, this isn't new. We've been doing this for 15 years, and not just in America, in over 120 countries besides America. So all over the world, this vaccine is given. And we've gotten to pool our data from all over the world. So we have a lot of information on this. And when you look at all those millions, and I mean hundreds of millions of people have had this vaccine, not just millions. I think when I last checked in, it was about 2014, 170 million doses of this vaccine have been given. So by now it's, right, got to be over 200, 300 million doses have been given. So again, not something we're not sure of, not something new and rushed, something really tried and true all over the world. 20 people have died since getting this vaccine, and that's been reported. Well, that's kind of scary. Remember, 20 people out of 200 million is incredibly rare. And when those 20 deaths were looked at, it turns out they weren't actually related to the vaccine. They were deaths from other factors. So if someone got the vaccine and went home and ate a steak sandwich and choked and died from choking, and that was reported, it's okay that that was reported as a death. It's important to know if people die around the time they get a vaccine. But the most important thing to tell you, there's a very important phrase in medicine that causation, let me get it right so I don't screw it up, but that correlation does not imply causation. Correlation does not imply causation. What does that mean? It basically means just because two things are correlated in time does not mean that one was caused by the other. This is really important when you think about COVID vaccination as well. I just have to give a plug for that because, again, if you get the COVID vaccine and then you get a rash or your eye twitches, it could be from the COVID vaccine. It absolutely could be, but it's not necessarily from that. Tonight, we're talking about the HPV vaccine, and this applies to that as well. So again, if you know someone or read something on the internet that someone got the HPV vaccine and then they gained weight, maybe, I can't say 100% it wasn't from that vaccine, but it doesn't mean it was either. We don't know. Was that person overeating? Were they stressed and stress eating? Did they have a thyroid condition? We just don't know. So be very, very careful what you read, especially on the internet, about someone saying, I got the HPV vaccination and then I ended up needing glasses. I mean, out of a couple 100 million doses, I think we would know if this vaccine caused blindness or sight changes. But I'll leave that to you to make good, smart decisions. If you're not sure, there's a website called immunize.com, immunize.org, I think it is, or vaccineinformation.org, vaccineinformation.org. And that's where you can kind of get the skinny, all right, on what's going on. So what kind of vaccine is this? A couple things it doesn't have. It doesn't have mercury, which people worry about. It doesn't have thimerosal, a preservative that people worry about. It doesn't have live virus in it. Doesn't even have dead virus in it. It just has little tiny viral particles in it, just enough to cause irritation at the arm where you get it, and just enough to generate a response to an immune response. Let me think of some of the other questions I get asked because we don't have that much time left. Oh, I know a good one. People always ask me, is this protection forever or is it just for 6 months? Is it like the COVID vaccine? What is it? So the truth is we don't fully know. Remember, it was discovered in 2000. I mean, it was licensed in 2006. So we don't have 30, 40, 50 years of vaccine info on this. But we believe its effects seem to be good for over 10 years. And that's great. And if you need a booster every 10 years, great. But so far, we don't think you do. So we tell people we believe this is lifelong, but stay tuned. We may find out down the road that you need a booster at some point. The vaccines recommended by the CDC, by the American College of OBGYN, the American Academy of Pediatrics, the American Academy of Family Physicians, probably Oscar nominated and Emmy nominated and everything else. So it doesn't seem to be any savvy medical body that feels this is anything less than really important and necessary. Here's another question someone asked me the other day. Can the HPV vaccine cause HPV? And remember, there's no live virus in it. So the answer is no. It can't cause HPV because there is no live HPV virus in it. So again, there have been deaths reported following the HPV vaccine, but these are women, when they did follow up on those reports, the events occurred the events that killed these women occurred in these women more frequently than in the general population, and correlation did not imply causation. We do not believe they were due to the vaccine itself. Let's talk about how effective it is, because I don't want anybody getting a vaccine that's not effective. So there have been lots of studies now looking at people who get all 3 shots. Getting all 3 shots seems to prevent nearly 100% of precancerous cervical cell changes caused by HPV. So I'm speaking specifically about cervical cancer. It's not that common a cancer. Only 40,000 women a year in the US get cervical cancer only. But of course, if that's you, it's 100%. So we know that if you get all 3 vaccines, you have almost 100% reduction in the likelihood of you getting not even just cervical cancer, but the precancerous cells that lead to cervical cancer. And what about prevention of cancer in the anus? So again, think about gay men and men who are having anal sex or receiving anal sex. The efficacy is about 78%. Again, not perfect, but boy, a whole lot better than not getting the vaccine. So among all men, this is indicated for, but in the gay male population, this can be an incredibly important vaccine. Other questions. I'm just looking through questions people have asked me. Oh, yeah. If I get the HPV vaccine, do I still need a Pap smear? If it's so perfect, maybe I can just skip my Pap smears. Um, no, sorry. You still have to get Pap smears because number one, who knows if the vaccine's not 100% protection for you? And first of all, remember, I said there's well over 200 strains of HPV. And so far, our vaccine only covers 9 really bad ones. So if it were to me, I wouldn't leave 192 strains out there to go undiagnosed. Um, and number two is some women misunderstand or they forget and they only get 1 or 2 of the shots. If you only get 1 or 2 of your 3 shots, you do not have complete protection. So you'd be surprised how many women get a shot, then they move to another state, they get another doctor, they forget, the other doctor doesn't ask, or the doctor says, "Did you get an HPV vaccine?" They say yes, and nobody bothers to check whether they got all 3. And those women are not completely protected. I think just getting the vaccine doesn't really mean you can never use a condom either. I think, um, again, condoms protect us from a lot more than HPV. So not fun, but important to use. Um, what else did I want to say? Oh, just whether it's covered by insurance. I mean, many health insurance cover vaccines. I think most do, but there's also a program called Vaccines for Children, VFC, that provides free vaccines to children up to the age of and adolescents up to the age of 19. So there's lots of ways you can find to get free vaccination. Um, I think I touched on same-sex men and women, but HPV vaccine is recommended for females and males regardless of their sexual orientation. That's really important, I think, too. Um, does anyone have any questions? Any of you guys have anything you want to bring up? I feel like I've been talking and talking, and I just want to kind of make sure you know, I got a lot of questions about men and do we need this and do men need it and why do men need it? And again, remember it's effective against genital warts, against anal warts, anal cancer, cancer of the throat. And I think men should play a big role in this prevention for other men and for the women they have sex with. So yeah, there's absolutely 0 reason to not get this. Sorry that this ended up being a monologue more than a chat. We'll try for 2022 to have this be much more about um, you all learning about important topics in women's healthcare from some of the great guests that I've had. COVID has hindered that a bit, but we will get back on track and get some great guests lined up. The next gynecology is a continuation of this. It's focusing on Pap smears. Okay, that sounds kind of boring, but not really. There's so much confusion about it. When do I start? How long do I get it? When can I stop? How often? Um, what does it check for? Does it check for HPV? Does it tell me the type of HPV? So much to learn. And this is basic stuff that you should know. You shouldn't wait for a doctor to tell you this. You should know this so that you know what's normal. And then you're also going to know if you're not getting what you need out of the clinic you're going to. Any other questions for me? You can always reach me through my website, princetongyn.com. My name is Dr. Maria Sophocles. This is Gynecology, where we teach you the big girl and big guy stuff you need to know. And I really appreciate your time. Stay warm, stay safe, wear your mask, and get your vaccines if you can. Thanks so much. Have a great night. Bye.